Honorable Kiraito, the Governor of Meru, the leaders at large in Meru County. I just want to take this opportunity and privilege to really discuss a few things with you guys about COVID-19 or coronavirus because, I'm Kiremi, Betao Kiremi, and I'm the son of Meru, and I am here in the US. I work in ICU, two different hospitals, the UCs and also Dignity Health. So my knowledge is just to help you guys as we navigate through these tough times, trying to figure out what is COVID-19 and what can we do as members of the community to be of some help to our people. So I just want to get to the computer here and we can look at a few things that I would like us to discuss. So turning around here. And I want to give a little introduction about COVID-19 and some things that I found out. The facts that we need to know is that we should know that it's legitimate for people to have questions and asking themselves, should I be afraid? Should I be fearful? Should I be concerned? Should I be alarmed? All these are very genuine questions. But the best advice that I can give to the people is that please do not panic, because the only thing you can do is to be careful. And we shall get through this as a family, as a society, as a county, nation, and even the world at large. So coronavirus disease, COVID-19, is an infectious disease that is caused by a new virus that has flu-like symptoms and appears within 2 to 14 days after being exposed to it. And how does coronavirus spread? It is believed that COVID-19 spreads from one person to another through touching infected surfaces, through touching your mouth and also touching your eyes. It's also believed it can be between people with close contact, with one another at a distance of 6 feet, and through respiratory droplets. When an infected person coughs or sneezes, the droplets can land in somebody else's mouth, or it can stay in the nearby environment for about 3 hours. And if you're not careful, you can get infected that way. And also the surfaces, if you sneeze or touch a surface, if you're infected, you can leave the virus there, and it can last 2 to 24 hours. There's some studies out there that are showing that it can even last a longer time. And the steps that we can do to protect ourselves and others around us, let's remember that the prevention is better and easier than cure. So let's remember to wash our hands. That's the key number one. And it's good to wash your hands for about 20 seconds. And if you don't have water available, you can use alcohol-based solution in medical settings or in any other place where the water is not available. And then when we cough, we need to cough on our elbows and not just coughing in our hands, because when you cough in your hand and shake hands to somebody else, you can spread the disease that way. The other thing to remember also is that, let's avoid touching our faces and also avoid touching our eyes. They also advise for us to stay 6 feet away from one another, which is roughly 2 meters away, or if you want to be very specific, about 1.8 meters. So let's call it 2 meters away to be on the safer side. And then the social distancing, please avoid large gatherings or any shared or closed spaces like schools, churches, banks, buses, the matatus. Let's avoid it as much as possible. I know sometimes we have to go to places, and that's kind of things we cannot avoid, then we have to do what we have to do. Then if you feel sick, please stay at home as much as possible. And then the other thing we need to advise our community is a 15-day quarantine in order to slow the spread of the coronavirus. And also isolation. If somebody is contagious, we need to isolate these people in a specific place. And of course, quarantine, this is restricting movement and keeping people where they are. And the goal is for doing all these things is to avoid being infected, to slow down the spread of the virus, avoid spreading the disease to others, and also take care of the patient with COVID-19 safely and effectively, especially in the hospitals. So we also need to know the signs and symptoms of coronavirus. And mostly the younger people and children might be asymptomatic. That means they don't show any signs and symptoms. However, the older people are able to show symptoms like a very high fever, like a temperature above 100 degrees Fahrenheit, 101, 103 is being reported commonly nowadays. And then there's also difficulty breathing or shortness of breath, and mostly it's a dry cough. There's no mucus coming out. Persistent pain or pressure on your chest, new confusion or inability to arouse, you feel very sleepy, some bluish lips, sometimes stomach aches, nausea, vomiting, muscle aches, and it's mostly affecting the people at high risk. For instance, people with chronic medical conditions, and that we say the elderly and people with chronic diseases like chronic medical conditions like lung or respiratory failures, heart failures, and also diabetes. Therefore, in as far as the medical aspect is concerned, in conclusion, please do not panic, but be vigilant, be observant, wash your hands as often as possible, stay indoors as much as possible, avoid crowds of people, and avoid shaking hands. This can wait, please. Just wave at your friends. So some of the recommendations for my people in Meru is please, the Meru governor, Mr. Kiraito, and the other leaders involved. I was looking at the Meru website. I didn't see much information about the COVID. So please update Meru County website with information about COVID-19 and keep it updated if possible on a daily basis. Then for at least probably 5 phone numbers listed on the website and also available to social media, whereby people can call if they start having any symptoms of coronavirus. And then also, if possible, please set up maybe about 10 vehicles that can be used to transport the people with COVID-19 to the hospitals, so that they don't use the motorbikes and these other means, which can be also lead to more spreading of the disease. I know the government right now has a lot of vehicles, even CDC vehicles. So we can designate maybe 10 vehicles in the county. If somebody calls, they are sick, let's go get them where they are and let them be examined. And also I advise in those 10 vehicles to probably have a clinician like a nurse or paramedic equipped with at least a thermometer and maybe a portable blood pressure machine if it's available, just to check the blood pressure, the heart rate, and see if this person really shows signs and symptoms of COVID-19. And also let's also know that 25% of people out there might be asymptomatic. They may not show any signs of coronavirus, and therefore they might continue infecting more people, and these people may not know. So that's something else we need to pay attention to. And please, do not rush to buying ventilators, which might be very very costly, because sometimes we panic and we end up doing some things like going to buy the ventilators in order to get these people better. But I was looking and I found out like maybe a ventilator might cost 2 million Kenyan shillings. And I advise that instead of using that amount of money, it can be used to inform people about COVID-19, and also maybe provide like food to people who are getting out and about looking for food. In essence, they are also spreading. If one person has a disease, they are spreading. If we can use like that, for instance, just a rough number, 2 million to buy food, this can keep thousands and thousands of people at their homes without going out there, which can reduce the number of people that are being infected. Because in my experience in ICU, and also the statistics out there, about 10 to 15% of the people that are getting in ICU are able to recover. So in other words, about 1 person out of 10 is able to recover, and that's with a lot of intense care from the doctors, the respiratory therapy, and other pharmacy, and a lot of input is being put to that 1 person that is surviving. I think Meru County, we can utilize that money doing something else different and help our people, other than spending so much trying to save 1 life that we might not be able to save. By the time people need a ventilator, their illness is so advanced, these people are barely making it. So our advice, if we don't have any ventilators, please do not rush to buying them, because I don't think it will help that much. And so that's really some of the things that I'm finding out there, and I advise the leaders in our society, please provide the PPEs to medical staff, especially those who are in a very high risk areas like in ICU, and people taking care of positive COVID-19 patients, and those who are presumed to have COVID-19. And then the treatment, I know people have been talking about the treatment out there. Let me say for sure, there are no certain medications currently. However, there are some of the things that people can do, and there are some medicine that are being tried. So take enough rest, drink enough water. If possible, add some salt, unless you have other illnesses preventing you putting some salt in water. If you have the illness, put some salt in warm water and sip it and gargle it a couple of times a day. And then if you can, or if the government can, please, you can provide mostly vitamin C's, a bunch of them, to people who are ill. It seems to be helping some people get a little bit better, especially the first week. And then there's this thing, medication-wise, is azithromycin combination with hydroxychloroquine, so, but it's not fully 100% effective, but we can always advise people, if the government can be able to buy and give it, why not? We can try it and see if it works. And then the other one I see being tried is Remdesivir. So if that one, you want to try that one, those are some of the things that I think can help us. I'm continuing to learn and evolve on this issue, so please, if you need more information, you can let me know. I'll be available to answer your phone calls and also advise as much as I can, and I'm always available, to update and inform people as much as I can. Thank you very much. God bless you, and may God continue blessing Meru County.